Specialists in emergency medicine say the situation is being managed in Gauteng and the standard of care is not being compromised. Barry Bateman has that story.
Government predicted the spike in Gauteng's COVID-19 cases. And it's what was prepared for. But the South African Private Ambulance and Emergency Services Association says this has meant more hospitals are diverting patients to other facilities because of capacity challenges.
We were all expecting an overflow at hospital facilities as the COVID infection spread. I think what has caught us a bit by surprise is just the rapid rate at which we're now seeing facilities being at capacity and not able to accept patients.
But Wright stresses the situation is being managed accordingly.
The critical patients are being fast-tracked, so that we are not experiencing, as long as hospitals aren't on divert, as long as they are able to accept the patients, we are not seeing any excessive delays in actual clinical delivery of treatment to patients. Where patients need immediate intervention, they are getting it at the moment.
Another aspect is the impact COVID-19 is having on hospital staff. This could reduce the number of patients a facility is able to care for.
We have more cases of healthcare workers, nurses, doctors, paramedics, all the categories also testing positive because they live in communities, they interact and so on.
Those receiving the patients from ambulances have confirmed the impact the surge has had on facilities.
There's definitely a logic between increased disease burden due to COVID-19 and pressure on the hospital's ability to absorb all of these patients. I mean, every hospital, whether it's government or private, they are managing, if you like, a twin disease burden of the normal or everything else and COVID-19.
While the pressure is on, being prepared has meant hospitals are coping.
The A teams are all on duty. And so the doctors, the nurses, the auxiliary healthcare workers, everyone is literally firing at 110%. And I think that the safe message is really a patient who's arriving with a healthcare need, whether it's COVID-19 or not, whether it's trauma or medical, they're going to get the usual standard of good South African healthcare that we've come to expect in our different facilities.
Both Netcare and Mediclinic have also confirmed the increasing demand on their facilities. They, too, have put in place mechanisms to cope. No one plans for an emergency, and if one arises, the public should not hesitate to seek help. But the plea from medical professionals is for people to stay at home if it's possible, to maintain strict hygiene standards, and to play their part so as not to add to the mounting burden on the country's healthcare system. Barry Bateman, Pretoria.